right about now. Okay, so now we're going to. Okay, we're live. So there's a 30-second delay, and here we go.
Is it possible for me also to record this?
I don't know if you have a button there for record on the bottom right, then you can do it. Otherwise,
Yes,
it's
sir.
all right. I will just record it, and I can send you the. I mean,
Okay,
the
got it.
file. So.
All right. Okay.
Okay, so for everyone who's tuning in to us from YouTube, I would like to request you to leave a comment here saying that you're here so that I'll be able to know. I actually see 19 people in the stream right now, but if you would be kind enough to leave a few comments down there, that'd be really nice before we start. So a few comments here from Kawal Singh, Bijay Fuyal, Krishna Teja Chalela. So everyone is here, and we hope to have a good session today. So let's wait for a couple of other doctors to tune in, and then we can start.
Excellent.
We're a bit early, so we'll start at 7 sharp.
So, Dr. Anurag, tell about the live doc. You've been doing the YouTube videos for some time now.
Yes, Dr. Agrawal. I mean, I actually wanted to start it as an awareness kind of a thing
Very
for
nice.
normal audiences, but after I started preparing for my CK, I could not give it that much time. But later on, I figured out that there is, I mean, a gap in the YouTube scene where there are not a lot of international medical graduates who are trying to guide, I mean, other international medical graduates in this journey. So I thought there was a gap, and so people have liked the videos so far. So I'm very thankful and grateful that it's been a really good experience. So today I'm able to do this with you. So I think it's a pretty good experience.
No, absolutely. It's so nice to see so much creativity that's out there in YouTube with all these videos, and really, putting all the information together to help others, whether it's in medicine or even outside medicine. And I really think this is the platform that YouTube provides, and for us to do these kind of live events, take questions from the audience. I really think that's very neat, and something that can really help everyone, especially medical graduates, medical students, who I think make up a large part of your audience. So again, this is amazing.
Thank
I'm
you
sure
so
this was
much.
not around like 10 years to 15 years ago when people were applying for residency and all. So it's just so refreshing to see how much good information is out there.
Yes, Dr. Agrawal. Like you mentioned, I mean, we have a lot of doctors who matched into the U.S. Residency. I mean, a lot of time, I mean, a lot of years back as well, right? But I can't imagine how they must have navigated the system, because even after having all these resources, it's really difficult to, navigate this system. But I mean, they were able to pull that off 10, 15 years back when there were limited resources and a lot of things were not clear. So I mean, that's really amazing how you and the other doctors they managed to get into residency there despite having so less information. That's really amazing.
Yeah. Even before, for example, like maybe people from like the 70s and 80s or not even 90s, um, I just admire how much courage they had, coming from being an international medical graduate, coming to a new country where they know nothing, and, where they're going to live, who's going to help them out, how do they prepare. I myself remember when I first, came to the US around 2005 or so. I knew exactly, where to get down in the airport, which side is going to be my bags are going to come on, south or the north belt, and the person who was supposed to pick me up told me exactly where he would be standing in that airport map, like a PDF. So, but just going blindly, okay, I'll see you at the airport. I mean, it's just so brave of folks in those times to have done all that.
Absolutely. I mean, that must have been a really amazing experience, like not having a phone and not telling someone where I am is one of the things that scares me the most right now, not being able to tell someone that I'm here. Okay. So that's I mean, one of the most scary things that can happen to me. But at that time, with that information, and that's really amazing.
Right. I
So,
mean, I can give you exact location, on the GPS where exactly you are. So it's amazing the technology that we have now.
all right. So I think we've got around 22 people joining in with us from YouTube. I guess other people will also pour in. So it's 6:57. I would like to start with, introduction of Dr. Varun Agrawal, why he's here today and what the things that he's going to cover. So I think we can get into the session right now, I guess. So can I start the session, Dr. Agrawal?
Absolutely.
Okay, so welcome everyone to the Life Doc here as always. And today I have a special guest for you, who's going to talk to you about residency. Personal statement, the do's and don'ts, and everything that happens after you finish your step 2 CK or step 3, after you've given all your examinations, the time that's used for applications and everything. This is where Dr. Varun Agrawal comes in and he helps people. A little bit of an introduction about him is that Dr. Varun Agrawal is a board certified physician who specializes in internal medicine and nephrology. So, being an international medical graduate himself in a coveted university teaching hospital, he's keenly aware of the special challenges that IMGs need to overcome in their quest for US residency. So, with his unique perspective, as an educational consultant, what he does is he reviews application materials, he conducts practice interviews, and basically what he does is he helps out international medical graduates improve their chances of a successful transition into a US residency programs. He has interviewed numerous medical students, both US and IMGs alike, for medicine residency positions, and he's served in residency selection committees at numerous institutions. So, with all due respect, I would like to introduce Dr. Varun here with us. Dr. Varun Agrawal, please.
Yes. Well, thank you, Dr. Anurag, for that kind introduction. Yes, that very much, summarizes, about me and edformedus.com, the service that I started about 2 years ago. And it's very exciting for me to be able to help out international medical graduates, especially to navigate this whole system of getting into a US residency program. I just wanted to tell a little bit about why I started this. So I've been, a faculty member and attending physician close to about, right now it's about like 10 years. And at some time, I started, to meet some observers who had been assigned to me, and while I was, working in the hospital. And I've had, the experience working with observers from India, Nepal, Pakistan, other countries. It was very clear that, these medical graduates, very bright, very intelligent, but very anxious, very scared. They didn't know how to move forward, with their application, how to prepare their application for residency, and a lot of focus happens on the USMLE exams, trying to score very well, sto- uh, you know, st- trying to score very well on on the USMLE exams. But what happens is it's not just the scores, it's the rest of the stuff like your work experiences, your research experiences, volunteer work, plus the other parts of the application like the personal statement, CV, and most importantly the residency interview, that also matters a great deal. So I've come across many applicants who are excellent on paper, but when they start to put together their personal statement or even on the practice interviews, they fail miserably. They are not able to articulate, not able to communicate, not able to carry out a conversation. And so all the effort that a person puts in goes downhill, just because of having trouble uh, performing in this interview. And so I chose to focus on at least these two aspects: the personal statement and ERAS CV review, and preparing applicants for the virtual interviews, because these are at least two areas I really feel not much is out there. And also, being an international medical graduate myself, I do realize how important it is to have both high quality plus affordability. I've also gone through what every medical graduate and student has gone through, and I know exactly how it's important to make these kind of services affordable and not cause more debt to medical graduates. So I'm very thankful to be here, interviewing and in the session here with Dr. Anurag.
That's very nice of you, Dr. Agrawal. So that's a great sentiment that you've been following so far. So let's get into the session today. We've got 31 people tuning in. So when we begin, so just to put everything into context, the ERAS season just opened for the 2022 match, and ERAS is Electronic Residency Application Service. Everyone knows that. So it comprises of a few things. So it has an ERAS CV that it's generated by itself after you put in your details. There's a personal statement that needs to be included there, LORs that you need to attach in that application, and that makes a whole ERAS CV. I mean, ERAS application, right? So, regarding this personal statement, I believe that everyone can make a CV from ERAS, and everyone can write a personal statement. I mean, they can just get started. But why do you think, Dr. Agrawal, is it necessary to review your CV and personal statement by at least once? I mean, at least someone, at least once. I mean, why is that important?
Absolutely. This is more important for applicants who have never written a personal statement in their entire life. So, especially international medical graduates for whom this is the first time writing a personal statement, what the matter that goes into a personal statement, there is quite a bit of confusion and not knowing if something that you write on the personal statement is appropriate or not. Now, also sometimes some applicants, they get so involved in their writing, it might make sense to them but not necessarily to the reader. For example, there was a personal statement I was just recently reviewing. It said something like, the sentence was about the applicant talking about the role model, and a physician who was the role model. And so she wrote, I was amazed at how my professor took the time to educate the patient about so and so health condition. Even though he was wrong, he chose to collaborate rather than make a quick judgment. So it sounds right, but then I, as a reader, was like, okay, when you say he was wrong, are you referring to the patient? Are you referring to the attending physician? So yes, the applicant will know exactly, what they wanted to write, but sometimes they get, these kind of things get missed and can cause more confusion. And secondly, for, especially for international medical graduates who are new to the US work culture, you know, things things that you write sometimes on paper might not make sense. So words like the inpatient ward, or things like compulsory, things like, there's something I joke about, like I shifted from here to here. These are words not commonly used in U.S. American writing, so it's nice to have your personal statement reviewed by someone in the academia, who has done residency and has a very good idea of, okay, this part makes sense or doesn't make sense, or fits or does not fit, and gives important feedback to improve your personal statement.
Oh, all right, Dr. Agrawal, that was nice. So, if I were to ask you roughly, how many applicants would you say? I mean, you have helped out so far. I mean, just roughly, if I were to ask.
Sure. So last year was the kind of the 2020 21 was the first year when I started working with residency applicants right from the previous match to the match 2021. So over the years time, and I reviewed about 103 personal statements and had about 122 residency interviews, practice interviews, that was done. And I really feel that this was that the guidance that residency applicants received, it really helped them. And many of them did match, and I got a lot of good feedback, and there are testimonials on my website that you can certainly look at.
So, what would you say has been your, I mean, experience with international medical graduates from Nepal?
Absolutely. So, yes, I've had some residency applicants from Nepal and worked with them. It's very interesting to know how the medical education system in Nepal, how it helps groom the international medical graduates who eventually want to come to the US. Let me give you an example. So, I understand from after working with some of the IMGs from Nepal that there is this 2 year internship, not really internship, but a 2 year like mandatory work that a medical graduate needs to do working in a rural setting, which is very interesting because it seems that the medical graduate that is the only doctor in that rural health center. So it's a young recent graduate who is out in a rural health center working for 2 years, from what I understand, with many opportunities, and that offers a lot of opportunities for leadership. I reviewed one applicant, and I've talked a lot about how this applicant led a was working in the not emergency room, but in this rural health center, and there was an accident, like a bus accident, close to that town in close to that village in Nepal, and how this applicant, was able to help all these victims of the accident, people who got affected by the accident, triaging, referring, talking with leadership in the community, and trying to improve things. So this was a wonderful thing to put, wonderful event to describe in the personal statement. And of course, he certainly matched and is doing very well. When I understand from when folks work in Nepal, when the applicants from Nepal, while they're doing this 2 year work, I'm sure it gave you a lot of opportunities last year to work, set up a COVID unit. There was one applicant, I reviewed the application. He had set up a COVID unit in that rural health center. Whether it was a 10 bed, 12 bed, doesn't matter. But the fact that, you led creating that COVID unit. So that's amazing, information to put in a personal statement. And some of the applicants I worked with talked about there was a Nepal earthquake many years ago. So how they volunteered to help in that situation. So these are some very good examples, very good experiences that IMGs from Nepal have, and this is exactly the experiences, the skills, the strengths that you can show from these kind of experiences. They go a long way, and these applicants do very well both in their residency pursuit as well as in their medical career. So I've really had the pleasure of working with some IMGs from Nepal, and just wanted to share some of these experiences that I came across.
That was very nice to listen to. I hope that future residents, will also continue to impress you just like that, and the program directors, of course. So, moving into the session, I would like to ask you. So, the thing that everyone wants to know, right, Dr. Agrawal. So, what's a dream candidate? I mean, what's a dream candidate that a program director would love to have in their program?
Right. So a dream candidate, a dream resident or an intern is someone who is certainly hardworking, very much committed to self-learning, self-improving, very easy to get along with other residents, interns, students, nurses, physicians. Someone who is willing to work hard, not cut corners, uh, someone who is very much able to work in a team and contribute and be a very valuable member of a team. So this teamwork skill is very critical. Someone who's a very good communicator, very clear in their communication, very punctual, very hardworking, making sure that they carry on the responsibilities as best as they can. I do want to say that lack of knowledge, it's not really too bad. If there is something that the applicant didn't know, for example, if they didn't know to request a certain test, or maybe they made an error in the dose of a medication, or they didn't know the right medication, that's all okay, because that is something that can be built upon. But the ability to communicate, work in a team, that's all that's all comes from your med school training. And so that's a really an excellent applicant who has all those skills that I mentioned. What's very interesting is program directors, residency program directors know very well when they read an application, when they interview, they will know exactly whether that person would fit into their program or not.
Um, Okay, that was nice. So, Dr. Agrawal, I mean, a quick question: would you say that there's a residency program director, or there's a residency program out there for everyone? Would you say that? I mean, there's someone that is waiting out there, so there's a perfect match for everyone else. Is it? Do you think that way or not?
It is true. I mean, some applicants might thrive in a large residency program that is competitive, has a lot of fellowships, but some applicants might like to not be in such a high intense program, be in a maybe community hospital where it's more clinical, a smaller program. So yes, maybe people need like to be in a certain city or so forth. For example, I could not see myself living in New York City. I don't have anything against it, but it was just too much for me. So having said that, yes, I really feel, and that's what this whole interview, the virtual interviews, it's an opportunity for you to see if that program is for you. Having said that, of course, there's a lot of competition too out there. So yeah, just do your very best in identifying that program that you feel you would fit very well. Whether it's again the location, or so for IMGs, they like to look if if there are other IMGs like them in the program, and there's so many other factors that they need to look at. But just do your very best and just make your application as competitive and put in your best application as you can.
So moving forward, uh, what would you say if I were to ask you what makes a great CV for an applicant?
So a great CV, when I review the ERAS CVs, I like to see that it's well rounded. That is okay. That I like to see that they have work experiences, they have some research experience, they have some volunteer experience, they have, if possible, some med school awards. So it's kind of I like to see all the boxes filled as best as I can. Other awards, accomplishments, so trying to fill that as best as you can. Um, Now, the CV still has to be brief. It has to be to the point. I really would not like people to just keep writing very lengthy descriptions, because program directors have very little time to review your application and make a decision. Should I call this person for interview or not? So make it brief, make it interesting, to the point. A very interesting thing is that there's been lately a lot of focus on hobbies. There's this question on what are your hobbies and interests. It's because once a program director gets an application, almost all the applicants have very good scores, have maybe US clinical experience. So it's these other things like the hobbies that separates you from other applicants. It's your personal statement and your experiences that separates you out from the others. So do not ignore the hobbies. If there was one applicant who was asking me, I don't have a hobby, what do I do? And I would say, okay, then think of something that you can, if you're into, for example, yoga, do the 200 hours, become a yoga teacher, and, that's going to be your hobby. So, things can still be built. It's not something that you have done since childhood, but do make sure you have some interesting hobbies to share with the selection committee.
So, Dr. Agrawal, you mean to say that it needs to be a well-rounded application that will get some heads turning, right?
Absolutely. So, making sure you have the work experience, clinical experiences, especially in the US, maybe some research experience. Even if it's a case report, try to fill that part up, and volunteer work. Yeah. So as long as it's at least these three are the big ones. So try to present yourself as a very well-rounded, very well-balanced, applicant, and that would be a very good CV.
Thank you for that. So, moving on to the personal statement. What kind of a personal statement do you think will grab the attention of the program director? I mean, there are a lot of things that are already in our CV. So, we've already mentioned a lot of things on our CV, but what should a P personal statement be like to just grab attention of the program director and make the program director feel like, okay, I need to call this person for an interview.
Absolutely. So the personal statement, certainly should be very interesting. And when you talk about attention grabbing, just because we have so less attention span, I really think the first paragraph is key. It's very important in making the rest of your personal statement worth the time of the program director. And that's the first paragraph is something that I like to call the hook. In writing, it's called the lead. That's kind of how it's described. But it's some story, some event that you want to share that is very attention that grabs the attention of the reader. It talks a lot about you and shows that okay, these are the skills that you're going to bring into residency. For example, I talked about like this applicant who helped out in taking care of the victims of a bus accident. So this person was a medical officer. He talked all about how he nicely mobilized all the nurses, other interns to help out these patients. And the leadership skills was what was highlighted in that hook, and I'm very, very sure that grabbed the attention of the reader. Because what happens is, if the selection committee, all the attendings and the program directors meet, this is how they'll remember. Okay, so you're talking about the guy who helped out, take care of the accident victims. You're talking about the person who taught dance to other medical students, and so forth. So that's why the first paragraph should be very important. And you know that's where when I do the review of the personal statements, I do come across some personal statements that are not rightly done. For example, some applicants would talk about, okay, there was an event in the family, a medical event in the family when they were a child, and so that's why they want to be a doctor. But that's not really needed in a residency personal statement. You have to talk about these other events. Especially, my suggestion is always about things that happened after med school. And the point that you mentioned, Dr. Anurag, about what the personal statement is about, it's not about repeating the information that is in the CV, but it is about talking about how those experiences, what did it teach you, how it's going to make you a better resident physician and a better doctor. And that's key. So, for example, in this applicant, who was so he talked about how he was teaching dance to other his medical students, other students in his class. So that's something that this whole teamwork, working in a team, and being creative, those kind of, and leading the whole dance group. I mean, these are the skills that can be applied to medicine, because you again have to work in a team. You have to communicate, be creative, think on your toes, think on your feet. And so the first paragraph is very attention grabbing. And you basically have to talk about your why. The other thing is, why are you interested in the specialty? So whatever specialty you're applying, you have to give very clear reasons, and and explain why you're interested in the specialty. Talk about your strengths, talk about your skills. An important question is, about red flags. So, applicants do have some reasons, some red flags. Maybe an attempt, a failed attempt in USMLE. Maybe they had to take some time off for some reason. So the personal statement is really the only place where you can talk about these red flags, explain it as best as you can, and but tell still show the program director how it helped you become a better person. So, for example, if someone did not pass step one but did very well on step two, I guide them to write, okay, when I failed the first time, I changed my approach on how to prepare for an exam, how to study, and I took more took more books or whatever, so, Q banks, and did very well on the next time, and I scored even higher on the step two and step three. So you just kind of present it very positively that things happen, but my approach is just to make the best out of it. And lastly, how are you going to, why should the program take you? How can you contribute to the program? That also goes into the personal statement. So if you look at, I do have a description on my YouTube channel where I've described all the 5 paragraphs that go in a personal statement for some of your, audience who want to look at that in more detail.
Certainly, I will make sure that I leave a link somewhere to your channel as well. So you mentioned that the things that need to be included and the things that need to be avoided as well, right? So the red flags. So moving on to the ERAS CV, just like you mentioned that there are some red flags which might arise in a personal statement. So can you tell us a few red flags or some things of concern that are an ERAS CV should not contain. So, any tips about that?
Yeah, I mean, sometimes some applications that I've seen, some era CVs that I've seen, the applicant, they write a very lengthy description, like, okay, you did a 1 month 1 month, say, observership. They'll write, some of that will be quite a repetition. So, for example, when you fill out this work experience about an observership, you need to say, you need to, like, fill out the form and say whom did you do that with, where did you do it, and so forth. And then the description, they would write, I shadowed Dr. So and so at so and so hospital, in the month of this, which is not needed because you already described that, earlier when you were filling out the form. But, and the focus should be on, again, talking about what were the few special things that you learned in that, that you gained in that observership. For example, you can talk about what EMR, electronic medical record, was used, because that's very key nowadays. If you did any presentations or literature search and so forth, describe that. Putting that kind of a description is needed. But just adding a lot of information, making it a very bulky paragraph, no one's going to read it. It's going to be a waste of your time, and effort to do that. So keeping it short is very important. I call it ABC: the accuracy, brevity, and clarity. So that's how you have to do the descriptions. So avoid complex words, avoid very lengthy, wordy sentences, and try to keep it, interesting. Again, for example, hobbies. So I've seen some applications where the applicant would write, as a hobby, I like listening to music. And now that makes, that's, very uninteresting. So you have to give a little bit more description. I like to listen to whatever, Western pop, rock, or something like that. My favorite, or I like to read books of this century, and these are my favorite authors. So this is how you would connect with the interviewer.
That is great. So I had one more, a question, and it might not be in the scope of this video, but there's been a lot of talk about the virtual observerships recently, because United States clinical experience is actually a very important part of any application. So, what are your views on? Because of the COVID pandemic, a lot of people have not been able to go to the US and get clinical experience. But in that regards, many of them have opted to go for virtual observerships. So, just a little bit into, I'm sorry if it's not in the scope of this video, but this is a question that I have, received a lot of times from a lot of my colleagues. So, I thought I should just ask you about that. So, what are your thoughts on telerotation or virtual observerships, basically?
Absolutely. Yes, I do myself get that asked. Now, the telerotations, I really feel it's helpful. I don't see any problem with applicants doing telerotations. It's certainly it's better than no US clinical experience. That's very true. It's, it's, an in person is a little bit more preferred. I think it has to do more with the fact that you are in much direct contact with the attending you're working with. And in person is, at least for, it's a very different experience. It's a more real live experience. But we have to realize that, since the COVID pandemic, a lot of medical practices are incorporating telemedicine into their daily practice. Residents are, having to do these kind of, appointments on telemedicine, on telerotation. So if you present it that way, if you present your application in a way, I did this telerotation, I learned, how to, how to do all the, do a history on the telemedicine counseling, writing the notes, maybe ordering medications, under supervision. I still think it's very valuable, because this is how medicine is moving, forward. And I really think there's no going back. So I really feel it is helpful. And in person is always preferred, but it all depends on what's happening with the COVID-19 pandemic. So what I'm trying to say is, if someone has a chance to do it, virtual observership, go for it.
Thank you, Dr. Agarwal. So all of these things were on your on a candidate's application, right? Scores is on one side, and there's the CV, there's the personal statement. So what about the interview? I mean, one of the things that scares me the most is, to go in front of someone and then just uh, talk about whatever thing is going on. So interviews, I believe, are one of those places where, for international medical graduates just like us, it's a little bit of a gut wrenching situation, So, how crucial you would say are interviews? I mean, you'd obviously say they're very crucial, but how do you think would a dream candidate go about his or her or their interview?
Absolutely. So yes, virtual interviews. It is difficult. You know, it has its own challenges. That in addition to what that person would have if they were to do an in-person interview, though I think virtual interviews is going to happen. More and more virtual interviews are happening. Many societies here in the US, organizations are recommending that that virtual interviews be done. A lot of it has to do in for the benefit of the applicant, who then doesn't have to spend their money or time to travel, and so it's certainly a very good option to have. Now, how to prepare for the virtual interview? So certainly, that's where all your communication skills are being tested. So just like how we're having this interview, the ability to sit in front of a camera, speak, look at the camera when speaking, and have at least answers to commonly asked questions clear in your mind. That's kind of the best way to go about it. And practice, there are lots and lots of websites about, okay, these are the commonly asked questions. AAMC, they themselves have a list out there. That's a pretty good place to start. And I would say practice, but don't over practice, because if you do too much, then all your answers sound very much like it's rehearsed, that it's not spontaneous. So what I typically recommend is when applicants go for the residency interview, it's called a 5-point rule. That is, have at least 5 points in your mind about your application that you absolutely want to pass on to the interviewer. So whether it was about a research study you did, your teaching experience, a certain clinical experience, a certain US clinical experience, or maybe a hobby, photography, whatever, make sure in that time, 20 minutes or 30 minutes that you have with the interviewer, you find ways to kind of let the other person know about these 5 points, which are key strengths in your application. So for example, there was someone I was interviewing who had a special interest in baking, and so she talked about, these are the kind of cakes that I bake. And so she asked the question to the interviewer, could you please describe how, are there any social events or outings that residents participate in? And so, this interviewer said, okay, yeah, we go out once a month, we have picnics and this and that. And then she very excitedly said, that's perfect. I can bring my cakes along to these gatherings. So, so she had it in her mind that I have to make sure this person knows about it. And she found a way to, kind of explain that she has that skill that will allow her to fit well into the program. So, preparing it that way, doing practice interviews, certainly with consultants like myself or other professionals, mentors, other residents maybe, wouldn't recommend practicing with family members, but someone who can at least who knows the process and can give you some feedback about that. I think that's the best way to prepare for this interview. And yeah, so it just takes a little bit practice. It's just another skill, just like swimming or biking, another skill to learn, and it's certainly very doable, as long as you keep working at it.
Yeah, thank you, Dr. Agrawal. So you have set out on a mission to help people get into their dream residency, right? So how do you, help international medical graduates regarding this? So a little bit about how you help IMGs out, and what your mission is and how you have been accomplishing it. A little bit about that, and then I think we can go into the question and answer sessions. So I'd like to ask the participants here to type in the questions. I will be looking at the questions and I'll convey all the questions to Dr. Agrawal. And while you do that, please, Dr. Agrawal, so your mission and how you have been, doing things out, helping people.
So what happens is, after so like this year, it's going to be September 29th, I believe, is the date when applications will be reviewed by programs. Subsequent to that, I start setting or scheduling appointments to have these practice interview sessions with applicants. After I receive the CV and the personal statement from that applicant, I kind of review it carefully, try to devise questions, some common questions, some questions based on their CV that need more clarification, and it's called behavioral questions. Um, that is, or it's called situational questions, questions that you might face, these kind of situations you might face in your residency. What are you going to do about it? Um, are some questions that I create, and then we set up a certain time to have this practice interview. I do the interview for about 30 minutes, because that's kind of the common format, 20-30 minutes with the interviewer. I really don't believe it's longer than that. And after those 30 minutes, I immediately give feedback. Okay, this is what you said, or this didn't make sense, or this can be said better, or this is how you need to answer these questions, um, and uh, and help guide them refine their answers. That takes about 45 minutes, in addition to the 30 minutes. And it's all recorded, so then the applicant can look at it again and review it carefully, to see if there was any other point that got missed out. And I really feel that works very well, because you're kind of in an actual interview. You don't know me, and you're and I'm interviewing you. So that's why I first start with the interview, get that out of the way, and then I give feedback. I really feel that's a very nice way of doing it. It Certainly the applicants I've worked with, they've been very appreciative, and again, you have given very good feedback about it. And that's it just takes off some of the anxiety. Some might struggle even with, like, for example, knowing this platform like Zoom and so forth. So just going through it, a couple of times, I really feel they are less anxious, more comfortable, more confident when they go for their interview. And in the end, everything else that you do, if you're not doing well on an interview, then then it's very, very difficult to kind of resuscitate your whole ERAS application, your whole application. So that's why my focus has been on the statement as well as the interviews, because I really feel, especially for IMGs, uh, who might not know a whole lot about the work culture, or how things happen here. It's nice for me to work with them and explain to them, and guide them uh, through this process.
So uh, having a bad application and having to resuscitate is always better than, just it's if you didn't just rejuvenate your PS and CV, then it's better than just resuscitating it later on, right? Dr. Agarwal?
you might not get a chance to do it. You might not even get an opportunity, because a lot. So you're not, a person is not going to be able to match if they don't get an interview offer. So that's why, getting your application together, putting in your best application by, September 29th, for this year, I believe is the date. um, that's the best you can do to get an interview offer. And then beyond that, doing your best at the interview, and that's how you get into a program.
So you also review the application and personal statement as well, right?
So right now I'm reviewing personal statement and ERAS CV. That all is done together. And as the application season moves forward, and when interviews start, that's when I start doing the residency, the practice interviews.
Okay, that was great. So before we get into the questions, I see a few questions in the chat. Any word of advice, Dr. Agrawal, before we go into the Q&A session?
So the word of advice would be that you know there's again a lot of information out there about the whole residency application. A lot of and there's going to be some, at least, misinformation also out there. What I do, at least, is when I'm letting you know about my thoughts, my opinions, I give an explanation as to why I'm saying that. So if for example, when I do these PS reviews, if I have to say why this doesn't fit, I give an explanation. So whenever you're hearing thoughts and opinions from others, try to understand why that person is saying that. And um, and I really think that's the best way you can judge, what's true or not. And just just kind of keep working on your application. Keep networking. Networking is another important thing that we didn't really talk much about here, but connecting with folk, connecting with other applicants, connecting with other graduates from your med schools who are in the US. um, and trying to use those kind of resources. I know there's a very strong, I believe it's called American Nepal organization, that's really, I believe, working to help out residency applicants. So trying to connect with them, trying to get the word out there that you're applying. Are really, the word of mouth factor is very, very important in residency applications. So make your connections, either when you're doing these observerships, rotations, research. Do social media, that just like how we're doing, or on Twitter. I'm not going to say that's going to get you an interview offer, but there's a lot of good activity happening on things like Twitter. I'm not sure about Instagram, but try to participate, and kind of make sure you have a good social media profile. Because I do remember this one person, for example. He was saying how I think a program director looked at his LinkedIn profile. LinkedIn is able to give those kind of information. So people are checking out what's happening, what's kind of your social media presence, I guess. So keep a clean social media profile. Work on networking. Um, don't be super anxious. Reach out for help. For example, on YouTube, I have a Facebook group also, where a lot of questions get asked and so forth. Reach out for help. Don't be distressed. And a lot of people say enjoy the journey. It is difficult, it is challenging, but once you get through it, you're going to remember it's a lot of fun.
Thank you, Dr. Agrawal, for that. So I'd like to move into the questions now. So Dr. Sagar Pandey has a question. So he's asked, can we mention a systematic review that is accepted in Prospero but not published in a journal in our CV? Okay. So, I mean, some unpublished publications in the journals, but it's published in Prospero. Should you include it or not?
I'm not exactly sure what Prospero is. Is that a website or a internet journal? Would you know?
I too am not updated on
Okay.
Prospero, so I'd like to ask if
Yeah.
Dr. Sagar Pandey is, if you're still tuning in, please let us know and we'll answer your question after that one.
Yeah,
Okay,
but
so
maybe I can just say that there is a section for, I think it's called non-peer reviewed journal, or there are, if someone published a blog about something medical, they can certainly, there is a section in ERA CV to talk about that. So if that's what the Prospero falls under, they can certainly mention that.
okay, so Priyansha is, I think she's a doctor, and her YouTube account is set up that way. So, Dr. Priyansha asks, are paid telerotations done in clinic settings looked down upon by the programs?
I don't think so. They're never going to know that it was paid or not. So there's no way for them to know. No one's going to spend time um, trying to see whether you paid for that clinical experience or not. It's just a clinical experience that counts, and how that what did you do in that clinical experience? How did you make the most of it? Did you, like, for example, search the literature on an interesting patient when you had an important clinical question? Those kind of experiences matter more than whether it was paid or not.
Okay. The next question is from Dr. Krishna Tejachala. And like you mentioned, LinkedIn, right? I know Dr. Krishna Tejachala from LinkedIn. So he has a question about do you recommend a Caribbean medical student to add 72 weeks of clinical rotations to the work experience of ERAS as a description of each rotation or not?
So if it's a medical student doing a medical school rotation, no, that doesn't come under work experience. So work experience is everything that all the kind of work that you do after you've finished. Like, for example, in Nepal and India, it's after your final year of exams and just before internship. So anything you do after your final year of exams, that counts as work experience. But if you're a medical student doing like a rotation surgery, medicine, and all, no, that's not work experience. That's part of your training, your learning. So you don't need to include that. But if you worked, you kind of worked in a clinic after graduating in that capacity, like as a surgery medical officer, I think, or a surgery resident or medical resident, then yes, that is work experience. I believe that's what the question was about.
So another question is from Dr. Sheila, and she asks, Dr. Agrawal, is there any set of interview questions that you can share with us for our interview practice?
Sure. If you can just Google AAMC, American Association of Medical College, residency interview questions, you'll get like a PDF. I think they have about 25, 30 questions. That's a very good starting place. Just Google search, you'll find it. Maybe I can send it to Dr. Anurag later too, but it's very easy to find. That's a very good starting point, I would suggest. It does not include all these, kind of behavioral and situational questions that are out there, that I think program director will just ask based on what you're telling and explaining to them. But at least, the common questions, at least you'll have a head start if you review the questions from that source that I just mentioned.
Okay, Dr. Sagar Pandey has written that Prospero is a platform for submitting protocol for systematic reviews before proceeding with research. So I too just got to know that about Prospero. So it's actually a platform for submitting proc, uh, protocols for systematic reviews before proceeding with research. So his previous question was, is it okay to publish, write that in your CV that it's not published yet, but it's there somewhere in Prospero. So that was his.
I think it's okay. It's not too bad. It'll be even better if you can complete the whole systematic review and get it to a point where you have at least submitted it to the journal, because that's something then you can put down in your ERAS CV. If you have a paper that's still in the writing stage, there's no way for you to cite that paper. You can put it as a research experience, but you cannot cite that paper. But the one that you mentioned, yeah, you can put the Prospero, the title of that post and the link. I think that's okay. It's uh, there's no harm in doing it. I'm not sure how helpful that is, but go ahead. I don't see any problem with that.
Okay. Thank you, doctor. So, my travel vlog MD asks, is adding online trainings in the CV suggested? Would it clutter the CV?
So there are these courses by, it's called Coursera and other platforms that offer some of these medical, um, I'm going to use the word courses, like, how to talk about tobacco addiction, or, those kind of courses are out there. I feel it's perfectly fine to do that. Make sure you don't have like hundreds of courses that that you're listing out. In fact, I do. One of the applicants I worked with, and it's on my YouTube channel, where he also did some of these courses, online courses. And he interestingly told me in that interview that he was asked about those courses. How did you do it? Where did you do it? What did you learn about it? So make sure, don't like write 10, 20 courses that you did. Maybe write 4 or 5 very pertinent courses that you feel will help you in that specialty that you're pursuing. Beyond that, I really do. I think then it starts to look very like you're just it's called padding. You're just making your CV look big by doing these courses. But 3, 4, 5, I think that's pretty reasonable.
Okay. Uh, so, Dr. Agrawal, I believe this question is, I mean, one of the most difficult questions, I mean, that everyone gets. So, Dr. Ashish Shrestha has asked, how to answer, tell me about yourself. I mean, I think it's one of those questions that scares me a lot as well, because, most of us, we don't believe that we've actually known ourselves to say what, I mean, you need to say about yourself, right? So how do you think a candidate can go about to prepare for this question and answer it in a very good way?
Right. So, uh, of course, when I do my interviews, almost like 9 out of 10 times, this is the first question that I ask. Tell me about yourself. It's called an icebreaker. It's basically, the interviewer doesn't know you and is giving you the chance to just talk about yourself. What I suggest applicants to do is that and this is where that whole at 5 point rule that I mentioned earlier. This is where it starts. So I'll give you an example. I'm just making it up. Doesn't apply to me. So one applicant, this is how they would answer. So I'm an international medical graduate from Nepal, and what's very interesting is that I got into that, as part of my med school training. I was able to have, besides doing my clinical training, I also developed skills in leadership and teamwork when I organized a cultural club in my college. And that's when I really enjoyed working as a team. During my in my later years, in my final year, I had a very strong interest in internal medicine. And I subsequently, I subsequently did my U.S. clinical experience that really helped me learn about the U.S. healthcare practice, and this, I believe, will really help me transition very smoothly into residency. At the same time, I also had worked in Nepal for about 2 years, where in a busy practice, busy hospital, I developed skills in organization, and setting priorities. And that's when, I really felt the importance of having good communication skills with my patients. And I really, that was a very good learning opportunity for me. Outside medicine, I like to go to hike, do a lot of hiking and like outdoor activities. My favorite hike has been to Mount Philo, so forth. And This allows me to maintain balance outside medicine, and with these experiences, I'm very interested to be interviewing with you today. So you took all your stuff, like, you grew up in another country, you were in med school, where besides clinical training, you had some other special skills that you developed. You did your clinical experience in US. You did some research experience. You have some other hobbies outside medicine, and you can end it by saying, with these experiences, I'm very interested. So I just made that all up. You can sort you have to like refine it, and so forth. But this is like a very good summary. So I know I would know instantly. Okay, this is what this person can bring to the program.
Thank you, Dr. Agrawal. So it's 7:56, so we have around 5-7 minutes left because we said that it would be a 1 hour session. So I'll quickly take the other questions as well. Um, so the questions are there. Prospero, we got it there. Okay, so this is a question by My Travel Vlog MD, and the question is it a good idea to send emails to the program directors and coordinators before the interviews in order to increase the chance of getting an interview? I mean, this is a bit out of our scope of this current session, but just curious. MD Travel Vlog.
Sure. Now, one has to be very selective in sending out these emails to program directors and program coordinators. You cannot just send mass emails to like the 100 or more programs. One, it's very time consuming, and honestly, programs are so busy. The program directors and coordinator are so busy at that time of the year. They might not. They'll certainly not have any time to respond to your email, let alone read it. What I would suggest is that if you have a reason for or an interest in a certain program, for example, maybe it's in the town that you're living in, maybe it's in a place where you did your research, or your US clinical experience, maybe it's a program where you have a friend from your med school. Maybe it's someone that there's a graduate from your med school who's in a certain program. You need to have a reason why you're writing to a program. Just saying that, hey, okay, I submitted my application, I'm interested in your program, it has absolutely no meaning. So don't do that, but you can certainly be selective. Write short emails as to why you think that program interests you, and I think that will be the best way to do it, because you should not really overburden programs by sending out these mass emails. It's kind of not very helpful. So that'll be the only time. Now you would do that after you have submitted your ERAS application, so that they can then look at your application and pull that and review it. Even if it got filtered out, it's certainly in a pile. So either you trying to not call them, but at least email them, or the best thing you could do is have your mentor or your friend or the graduate from your med school put in a word to that program director saying, yeah, I know this guy, do you mind reviewing their application for it and see if so and so would be appropriate for an interview. And that would go along with. That's why I was focusing on networking just a few minutes ago.
Thank you, Dr. Agrawal. So, Dr. Sheila Nyopane asks, do you suggest to include unpublished research experience from the medical school in CV? I have a similar question as well, because in Nepal, in the curriculum, we have got community medicine, where we go out for community medicine fields in different years. So in second year, third year, first year, third year, and fourth year, I guess. So we kind of we don't publish it, but we have these reports written out about a certain community, and all these things are there. So regarding those publications, just like Dr. Sheila asked, do you think it's a good idea to include those unpublished research as well?
So the only place now, if it's not been published or presented, the only place where you can talk about that would be under research experience. But we have to realize that if this is a part of your rotation, if you were required to do, say, okay, what were the vaccination rates in so and so community as part of a research, as part of that community medicine rotation, no, that's not research experience. But if you were like, okay, I want to know how to, I want to know something, I want to study something with this mentor, where on your own you're going out of your way to do this study, then that counts as research experience because you were not required to do it, but you chose to put in the extra effort to study that. So that goes under research experience. So yeah, have seen some applications like that where the applicant would talk about that kind of a community medicine experience, but no, that's not really research experience. You can talk
Okay.
about it in your personal statement if you wish, but again, it's that's not really like I said, a research experience or a research effort. But you can talk about the community work that you have done and describe more of the community experiences in the personal statement that way.
Thank you, Dr. Agrawal. So I think this is going to be the last question for the session. So no, I think it's going to be the second last. So I have one last question. This the last question was actually not related to our session, so I kept it for the last. But I've not forgotten about that comment. I will come to that comment in a while. But Dr. Bijay Fuyal asks, where in the application do we mention the courses or CMEs by Coursera, edX, and so on? I don't find a place to mention that in the ERAS CV. So where do you think you can accommodate all these trainings in the ERAS CV?
So there's a section called other awards slash accomplishments. Not yeah, so there is that section, that's where you would put it. You wouldn't put it under like med school awards and so forth, but this would be the appropriate place.
Okay, doctor. So the last question is from Dr. Karun Bhattrai. So he's actually a second year medical student right now, and he's already preparing for USMLE. So he's doing a great job. So he has a question that is there any probability that virtual interviews will be continued even during post-COVID days? Because that would mean that even after post-COVID, you'd be able to give interviews right here from your home country and things like that. So I know this is not in the scope of this interview, but what do you think? I mean, do you think there's a chance that this system of interviewing applicants through virtual medium is here to stay, or maybe we will continue with in-person interviews all in all? What do you think, Dr. Agrawal?
So I really feel that virtual interviews will happen. Because of the COVID, we realized how easy it is to get to know the applicant through the virtual format. Programs are becoming more and more comfortable using this, Zoom and everything, to do these virtual interviews. Um, I really feel that we're not going to go to like 0% virtual interviews. I don't believe that's going to happen. There's still going to be a lot of virtual interviews. Some programs might be looking into like a hybrid where the that first the interview happens virtually, but then there's a chance for the applicant to be there in person. I mean, it's still not finalized, for at least for now. At least this year, I'm seeing that it's all going to be, at least some of the organizations are recommending 100% virtual interviews. You can't really offer virtual interviews to some and in-person interviews to others, because that will be not fair to compare applicants from different interview for platforms. Having said that, from an applicant side, it does become difficult for you to decide, okay, how is this program, because everything is being, shown to you virtually, the hospital and so forth. But if and so that's a piece that applicants might have a little bit difficulty with. But now that at least in the US, that some if the restrictions are being lifted, you can certainly first do a virtual interview, and then at the second time at least travel to the place, get a feel for I don't know if you would be able to meet uh, the program director and the selection committee, but just get to know the area and see if that would be a good place for you to be spending the next 3 or many years of your life. So that option certainly will exist. So I believe virtual interviews are here to stay. It's just that are they going to be 100% or some kind of a hybrid? That remains to be seen.
Thank you, Dr. Agrawal. So, finally, before we wrap this session up, thank you so much for being here and answering all our questions. I hope this video is going to be, useful for other applicants as well who have yet to see this video, who are not here. And for all the people who joined in live, thank you so much for joining in. I had a great time interviewing Dr. Agrawal. And on that note, well, Dr. Sheila asks, thank you for your valuable time, first of all, Dr. Agrawal. And how can we reach you after this meeting? So, a crucial question, and I think it's best answered by Dr. Agrawal himself. If you may, Dr. Agrawal, please.
Yeah. So you can see my website. It's up here at formedus.com. So just you can go to the website. It has all links to, email, Facebook. There's very active Facebook groups where I do a post daily, at least a daily post talking about the residency application. I'm also on Twitter. You can get all those links once you go to my website and communicate that way. And that'll be the best way of communicating. And feel free to leave more questions or comments after this video. And I also have a YouTube channel if you want to look at other parts of the residency application. I've even talked about my own NRMP match, the rank order list that I submitted many years ago when I was going through the whole process. Some of that information, it's kind of no one shares, but it's something that I felt if I could explain to folks how to set up a rank order list by showing my own rank order list and how I made the changes. So those are some. I try to keep it that way. I try to provide more examples. I'm kind of that person who likes to tell more stories and examples. I think that sticks better in people's mind. So that's where you'll find me. So that's my website up there.
Thank you so much, Dr. Agrawal, for your time. So, with that note, I would like to close the session if Dr. Agrawal permits it. If there's anything else, please, Doctor. Otherwise, I would like to end the session.
Sounds good, Dr. Anurag. No, thanks so much for doing this. And again, it's I very much appreciate that you're providing very high quality and accurate information, to everyone else on YouTube and in the internet. And I look forward to meeting you again and working with you. And if there's again more interest in such YouTube live events in the future, probably once residency interviews start, I'm very happy to be a part of it.
Thank you so much, Dr. Agrawal, for your kind words. Far too kind for those words. I'm still trying to get used to this format and everything, but thank you so much for coming in. Thank you so much for your time. Even in your busy schedule, you've managed to come here and talk to us and give us a lot of information that would otherwise be a little bit, not as available in this format to other people. So thank you so much for coming in. Thank you to everyone who joined in this live session. This video will be uploaded to YouTube if you missed out on the earlier parts of the session. So don't worry about it. You can go to Dr. Varun Agrawal's channel. There you'll find a lot of content regarding interviews and how to prepare for them. Everything is there. So if you have a LinkedIn profile, then make sure you leave it down in the comments below in this video. I'll make sure that I add you on LinkedIn and we can connect there as well. So thank you so much for tuning in and making this session great. Thank you, Dr. Agrawal, once again for coming in. So right now, I would like to end this live stream session. So this is Dr. Agrawal, Varun Agrawal, and me, Dr. Anurag, signing off with a promise to meet you yet again in yet another video. And until then, you stay happy, stay positive, and as always, stay strong.